This presentation on schizophrenia and public policy will highlight what schizophrenia is as defined by both the DSM-5 and the ICD-10, some statistics about schizophrenia, current public policy regarding schizophrenia, and what are some hopeful advocacy plans for future policy. So what is schizophrenia? The DSM-5 places schizophrenia under the schizophrenia spectrum and other psychotic disorders category. These disorders are characterized by abnormalities in one of the following: delusions, hallucinations, disorganized thinking, grossly disorganized or abnormal motor behavior, and/or negative symptoms. The ICD-10 characterizes schizophrenic disorders by fundamental and characteristic distortion of thinking and perception, and blunted affect. The diagnostic criteria, according to the DSM-5, establishes there must be at least two of the following: delusions, hallucinations, disorganized speech, grossly disorganized or catatonic behavior, and/or negative symptoms, which could include things like diminished emotional expression or avolition, which is a complete lack of motivation to do even everyday tasks. At least two of these subcategories must be present for at least 1 month, and within that month they must be present for a significant portion of time. Signs of the disturbance must persist for at least 6 months. Other disorders, such as schizoaffective disorder and bipolar disorder with psychotic features, must be ruled out. The DSM-5 also notes some statistics regarding schizophrenia. The lifetime prevalence is approximately 0.3 to 0.7%. There is an emphasis on negative symptoms in males. Psychotic features typically emerge between late teens and mid-30s. Approximately 20% of individuals with schizophrenia attempt suicide, and approximately 5 to 6% are successful. And there is also a high rate of comorbidity with substance-related disorders. There are a number of groups and individuals who are affected by schizophrenia. This includes the individuals themselves who have schizophrenia, their loved ones and families, their communities, the taxpayers, the justice system, mental health professionals, hospitals that care for mental health patients, as well as pharmaceutical companies who manufacture antipsychotics and other medications for mental disorders. The National Alliance on Mental Illness has this great infographic showing the statistics surrounding the mentally ill within the criminal justice system. About 2 million times each year, people with serious mental illness are booked into jails. About 2 in 5 people who are incarcerated have a history of mental illness. Suicide is the leading cause of death for people held in local jails. 70% of youth in the juvenile justice system have a diagnosable mental health condition, and youth in detention are 10 times more likely to suffer from psychosis than youth in the community. About 3 in 5 people with a history of mental illness do not receive mental health treatment while incarcerated in state and federal prisons. Some current legislative changes have benefited individuals with schizophrenia and mental illness overall. The 1979 Supreme Court ruling of Callahan v. Carey gave homeless people in New York City the right to shelter. According to the National Epidemiological Survey on Alcohol and Related Conditions, people with mental health disorders have a substantially higher risk of homelessness compared to the general population. And people who are homeless are unusually likely to have mental health issues. Castilla et al. Found that only 3.9% of people who are homeless in New York City are unsheltered. The effect of this ruling can be seen in the growth of homeless shelter beds from roughly 11,000 in 1983 to over 60,000 in 2016. Furthermore, Castillo et al. Reported that the establishment and expansion of medical insurance through the Affordable Care Act and the Mental Health Parity and Addiction Equity Act can promote recovery. Findings from studies in Oregon and Massachusetts showed that health insurance expansions lowered depression rates and improved self-reported mental health. Additionally, there are 2 bills that were introduced to Congress in 2019 that help support individuals with mental illness. H.R. 3165 revises the mental health parity rules to require private health insurance plans that offer both medical and mental health coverage to prepare a comparative analysis of non-quantitative treatment limitations, which are NQTLs. And these are limitations on the scope or duration of benefits for treatment, such as pre-authorization requirements. And S1895, the Lower Healthcare Costs Act, makes changes to healthcare coverage, costs, and services. This would include requiring healthcare facilities and practitioners to give patients a list of provided services upon discharge and limiting prices that pharmacy benefit managers may charge health insurers or enrollees for prescription drugs. Finally, the Schizophrenia and Psychosis Action Alliance has a list of public policy priorities for which they are advocating. These include significantly increasing the annual NIMH clinical research budget, making incarceration and homelessness unacceptable outcomes, replacing incarceration and homelessness with medical treatment, entitlements, and supportive housing, eliminating the Medicaid institutionalization of mental diseases exclusion in order to increase available beds, promoting timely and appropriate diagnoses, treatments, peer support intervention, and education, as well as these numerous others. I believe expanding health insurance and providing better treatment options for those who have been involved in the criminal justice system are 2 of the most important policy needs. Providing health insurance expansion for mental illness would allow more individuals to seek treatment from a mental health professional and would allow individuals who stop taking medications due to their costs the ability to afford them. Providing mental health treatment instead of incarceration would give individuals with mental illness a more successful route to living more positive lives. While there are many policies in place to help protect individuals with schizophrenia and lessen the burden on society, we still have a long way to go to enact real change. Thank you.